do you suffer with headaches? Now, there's a lot of different types of headaches, but every one of them is terrible to deal with. I mean, I have patients that come to me and they're telling me they've got headaches every single day for the past 15, 20 years, and that this office was the first one to be able to get them relief. I mean, it's powerful stuff, but I also couldn't imagine that someone has to deal with that on a daily basis. And for a lot of people, that becomes their new normal. Having a headache is just something that they've become accustomed to, and they couldn't even imagine a life without getting one. Now, there's three main types of headaches. Okay, the first one are tension headaches. Now, when we see tension headaches, you're going to see that most of these people are going to have some poor posture, and they're going to have compression of these real tight muscles at the base of the skull. They're going to have really bad knots and trigger points all throughout their neck and shoulders. And these are the ones that traditionally are going to feel that stiffness after they've had a bunch of caffeine or dehydrated and are just working their butt off in front of a computer. Okay, tension headaches are actually the easiest of all to fix. Now, the second one are migraine headaches. Now, migraine headaches have a couple different triggers that can cause that, but primarily what we look at is we find that with migraine headaches, it's a combination of poor posture. There's usually foods that people are eating that cause some inflammation in the body. So for some people, it could be dairy. For other people, it could be gluten and things like that. So really being able to sit down with someone and assess their diet and be able to find those triggers that can spur those on. Okay, we have different things we can test to find that out and help with that. And really the last thing is we'll tend to find that people with migraines also are taking a lot of caffeine and are chronically dehydrated. So really being able to not only fix posture and work on somebody, but also deal with the internal. We have an extremely high rate with migraines as well. Now, the last one is called vascular headaches. Now, vascular headaches are when the brain is going to get too much blood trying to pump in. And the reason that the body does that is because you see, when we take very shallow breaths, either when we're nervous or we're stressed, or we just have a really weak diaphragm, the muscle down here that allows us to take large belly breaths. You see, most people, when they're stressed, they'll breathe with their chest. And so what happens is that they won't take in as much oxygen. And oxygen, which is a vital component of brain function, you see, when you don't take in as much oxygen, then your blood does not get as much of that supply. And so because your brain needs a certain amount of oxygen, it says, well, hey, if this blood is not very rich in oxygen, then I just have to pump more blood to my head to try to get that oxygen supply. And so what happens is people will feel that pulsating, pounding pain in their temples, and they always feel like they need to rub it. And these most often come up after someone exercises, in times of severe stress when they've changed their breathing. And so, guys, if you experience any of those three types of headaches, we have a lot of expertise in being able to treat all three. And the answer is not in a pill bottle, guys. Okay, that's just managing symptoms. All right, we're going to get to the underlying condition. We're going to fix this stuff. All right, because the last thing that we want to do is see you take a bunch of pills that are going to wreck your internal organs, get hit with Botox and paralyze the nerves around the base of your neck because they're causing pain. All right, there's so many things that people do out there for headaches that are just not what you need to get done. And that's what we're here to do. We're here to get down to the bottom of why you experience those headaches. And we have an extremely high success rate of being able to eliminate those or reduce it so that it comes up every couple months.